Hi, I'm Jeremy, Digital Trends. We review a lot of technology products. We review computers, we review smartphones, we review laptops. Today we're here to talk about another aspect of technology that's really being transformed in a dramatic way, which is healthcare. What I think is fascinating is the way that healthcare is being transformed on every level. We have a lot of things that we talk about, especially here at the show. We're seeing a lot of smart bands, fitness bands, gizmos like that, which are really tracking our health. But it's beyond that. It's the things that David is doing, fascinating stuff, which you're going to have to talk about a little bit later on here. We're seeing interactions between doctors and patients that are being transformed. We're seeing nurses, advanced care facilities. All of these things are really being transformed. It's a great time to be sick, let's be honest here. So we're going to try to bite off an incredible amount here and do our best to get through a lot of different stuff. I want to talk about all of that stuff to the extent that we can. Incredible area here. So we have a lot of experts from a variety of different fields within medicine to talk about this, the various topics here. We're going to go online. I'll give a quick introduction of who each person is. Maybe you can say a little bit about what you do. David Putrino, as you just saw, PhD in neuroscience, director of telemedicine and virtual rehab at the Burke Medical Research Institute. His ideas help enable the disabled. You were just talking about it, but for people that are just now walking in, maybe give a quick overview of what you do.
Sure.
If you can, give a quick overview of all of that.
Repurposing affordable, accessible technology toward healthcare applications.
In a nutshell, nicely done. Chuck Parker is the Vice President of the Personal Connected Health Alliance and Executive Director of Continua Health Alliance, Master of Science in Healthcare Informatics, if I have that correct. And he develops sorely needed standards for personal healthcare devices, is my way of putting it. Is that correct?
Yeah, that's correct. So that's what Continua does, is focus on getting these devices to talk together and making sure that we can create a plug-and-play environment for all these.
And as we see companies like Apple and Google coming along and stepping in here, I think your work is probably going to become even more valuable, something I'd love to delve into over the next couple of minutes. Jill Mecklenburger, Principal Audiologist at ReSound. If you don't know about ReSound, they make hearing aids that connect to the iPhone. Fantastic. Can you tell us a little about what you do?
Yes, thanks, Jeremy. Our company just recently launched the first made-for-iPhone hearing aid. So the hearing aid, not only is it a premium high-tech hearing aid, it interfaces directly with an iPhone, iPad, iPod Touch. So any audio from those devices stream directly to the hearing aid without any intermediary devices.
Which is fascinating. My best friend growing up had hearing aids, and it was always a struggle for him. And innovation in a space like that hasn't really transformed or changed at all in years is, I think, great to see. And Cédric Hutchings, of course, CEO of Withings. Withings. You all heard it here. You heard it here. Withings. Obviously, just introduced a brand new product. Maybe you can tell us a little bit about that.
We just introduced a new kind of activity tracker. We like it to call it the very first smartwatch. More generally, we develop tools to empower people to make more balanced choices and live healthier lives.
Great. Well, thank you guys all for coming. I'm sorry if I talk fast. I get excited. I get passionate about this stuff. I'll try to slow down and control myself. Tell me if I'm speaking too quickly. So let's start off. So the thing that interests me here, we're talking a lot about the quantified self, about gadgets and gizmos that track little bits of data about ourselves that we didn't have before. One thing I think is fascinating, devices like the Basis smartwatch, which tracks overnight how deeply you sleep. Information that we didn't have access to just a year or two ago, suddenly becoming available. Cédric, maybe you can talk about what exactly are we quantifying here? How much of that data are we aggregating, and are we learning at large about ourselves as human beings?
Yes, sir. And first, I was very happy to hear what David said before, because I think that when we talk about quantified self, we need to make sure that we develop things that are really relevant for healthcare. And so it's not, when we hear quantified self, it's not only about quantifying your steps during the day, which is very useful, because when we think at what will change really the prevention and the way we manage in our daily lives chronic disease, we need to find a way to bring home some messages that really belongs more to the communication or the PR part, which is, it's good to walk 10,000 steps steps a day, to make half an hour of limited fitness activity a day. We have in France these ads that remind us every day to eat 5 veggies and fruits a day. All that is about communication. So what Quantify itself is about is bring back home, with the right feedback loop, with the right dashboard, a lot of what you do every day toward this, goals that happens to be common knowledge, but just knowledge, and no action. So Quantify itself is about measuring what you're doing, and more, so also physiologic science, science, to understand or build what will be a dashboard. And I just end up with that is, I think that if today we would enter a car without any dashboard, we will not feel safe, and at least not comfortable, not knowing what is the fuel tank level. And I'm convinced with what we're developing, that we will see, these years as quite weird of having no dashboard of our own health and not being the one who is driving the health. A lot of time when we ask people who is taking care of your health, first answer is my doctor, which is very paradoxical. I think the answer tomorrow will be I am taking care of my health, obviously with the help of my doctors, but it's a very different kind of relationship.
Somebody said to me the other day that with all of these devices, we're going to see fewer doctors because we won't need to see them as often. And I said, absolutely the opposite. I'm going to take all of this information and get it to my doctor as soon as I can. But to what extent are we doing that?
Well, actually, I think that what we're seeing is one of the things that's happening in the developing nations is, and this is just an interesting statistic to throw out there and we go on, but here in the developing world, it's one doctor to about 4,000 patients. But when you get into in places like China, Brazil, India, it's 1 to 100,000. So it's not that we're not going to see less of our doctors. We just don't have enough, period, to really take care of individuals in some of these developing areas.
So the advantage of some of these devices is not just for us to know how many steps we take, but that doctors are able to access more patients. That's fascinating. That's great. Jill, to what extent does what you guys do affect the patient-doctor relationship? Is it independent entirely, or is there some connection in there?
It's pretty independent, but I would say one of the great advantages of this product is that not only can the patient control everything on the hearing aid from their iPhone, but they can also turn it into a remote microphone. So if someone's having trouble hearing their doctor, even just with their hearing aids, they can hand their iPhone to the doctor and have them speak into it, and it streams directly to the hearing aid. So just another great way to enhance that relationship.
Technology really enhancing a lot of different aspects. You mentioned just now extrapolating information from a smartwatch. And I'm really curious about this. To what extent are doctors today getting information from the fitness bands and the smart bands and whatever it is that we have? Is that happening today, or is that something we're working on towards the future?
Well, I think it already is starting to happen to a small extent. It's a very dicey road with a lot of these fitness bands, because you need to be careful that the data you're collecting is valid. So not just some, a pretty metric that they have invented themselves that says this is how much activity you did today, but if you do this 1,000 times, it'll tell you you've taken 1,000 steps. But what's important, and the reason it's important to deal with the raw data is because there are some studies that are emerging with these wearable fitness devices that use the patented activity metric and correlate it with patient performance. And the pragmatist might say, well, so long as it shows a good effect, who cares? But the thing that we need to just be very careful about is making sure that we don't privatize people's metrics, and we don't end up costing people money with seemingly low-cost data. But in general, I think it's a very positive field. From time to time, I come across people who say, clinicians who will tell me that I am trying to take their job away, and my response is always the same, sometimes delivered gently, sometimes less so, but essentially, if you think that your job can be taken over by a $50 to $100 device, then you're not doing your job. That is the bottom line. And the reason is that the way that we should be integrating these devices into healthcare provision is right now in most chronic disease management, what happens is a patient will see a doctor and their function will be here, and their function will sort of dip off between visits, and then they'll see a doctor and maybe peak up a little bit and then dip off. What we're hoping with the ability to do continuous patient monitoring on important metrics is to, okay, you leave your doctor, and now your health actually stays at a relevant level, so that the next time you visit, he or she doesn't need to be putting out fires. They can actually work on getting you to the next level of wellness, and that's the dream. And so.
So I very much agree on this, and so you said it before. It's not about confronting the patient. It's to understand and to have a relevant talk and exchange with the patient. But also, and I think it's a very important point, is that this whole compliancy will also enhance and increase because the patient has feedback. During the between two visits, has a lot of feedbacks and know where he has to, and having this kind of dashboard also, I mean, really change our own behavior. So we live, literally in the middle of dashboard and analytics about a lot of things, but very few times about ourselves and our health.
And what we're seeing, oh, sorry, go ahead.
I was going to say along those same lines, or interesting that you talk about people worrying about their job being taken away, but with the made for iPhone hearing aid, it's going to make the audiologist's life much easier because the patient has more control. And for example, they can adjust bass and treble for a restaurant, for example, and if they like that setting, they can geotag and save it to the iPhone. So in the end, they're not going back to their audiologist as much for fittings and using up that time. So giving them more control.
But going back to the question though about on whether or not we're going to actually see this threatened physician offices, what we, and like you, we're very blunt about the fact too, is that reality is that you don't see this patient enough, or you don't see enough about what's going on with the individual, and the fidelity of information that you have is going to go up. And the second fear they have then is, what am I going to do with 500 measurements a day coming from my patients? And the reality is that nothing. They're not the ones who really need to be worried about that at that point, because if you redesign the physician office flow, there are plenty of office staff who are actually qualified to deal with the individual more effectively. It creates much more teachable moments. So you have a dietitian in a diabetic clinic. That's what you actually want to see, is when they start to trend off and down a little bit, you actually give the dietitian and say, let's talk, Mr. Jones, about what you're eating over the weekend, because I see that on Monday you're really spiking your glucose levels.
That's genius and yet creepy at the same time. Yes. Please don't monitor what I'm eating daily. So to what extent, though, are you guys able to even out the information that comes off the various types of devices? Is that my understanding? Am I getting that correctly? That's what you're...
Well, it's not so much that you want to even it out. What you want to do is...
normalize it, I guess?
Normalize it. It's what you're really after. And that's what we're doing with standards, is to make sure that you have a common way of actually expressing that data. So that, when you take one weight scale and plug in another weight scale, it's basically the same. More importantly, when you take a blood pressure reading, it's, it's from one company, it's very similar to the next company. And so when you have the standards in place to do that, then it really becomes plug and play type of an environment.
Jill, I wanted to ask you a quick question. Did you hear about the SoundHawk Lynx? Do I have this name correct? This is another hearing aid type device, but it's a consumer product. It's from the same guy who founded your company way back when. He's come out with a new product. They just announced it this week, I believe. What's interesting, it does some of the same things where it adjusts the levels, and it lets the patient adjust the levels that he's of what he's hearing for the scenario that he's in. But they're not billing it as a medical device so much as a consumer hearing. I don't know how to phrase it. I forget how exactly they phrased it, but it wasn't something you'd get from your doctor. You'd get it at retail. Seemed to me sort of a commoditization of healthcare tech. It was kind of interesting.
Yeah, there are several what they call PSAPs, a personal sound amplification product that you can buy over the counter. And some of them are incorporating Bluetooth now, but it's not the same as the type of product we have, where we've worked specifically with Apple to optimize from the iPhone and have a proprietary streaming using Bluetooth Smart to stream directly from the iPhone or iPad. So
I got to ask, what's Apple like to work with? Are they nice? Are they friendly? Are they horrible?
They're wonderful.
They're
We've been working with them for a couple of years.
What's she going to say?
Great company.
Well, I think it's interesting to see as Apple moves into this space and tries to... I think that what they're trying to do is normalize some of the stuff, just as you are doing. Is that competition?
No, actually not for us. It actually helps promote the whole industry, because what we do is we set a standards for this, and using Bluetooth Smart is one of the technologies. The iPhones today and most tablets of the iPhone and iOS-based systems are Bluetooth Smart ready in this case, and so they have the capability of already connecting that data. So what we're doing is basically ensuring that the device is standardized so they can actually communicate in a common platform. So in reality, it actually helps us. It just expands that model that now you have a platform available on iOS. Google's made their announcements, so you now have it on Android. Then you have some very specific ones with things like Samsung coming out with their technology. So it's really putting an emphasis and sort of broadening the scope that this is something that's out there now that the major tech companies are paying attention to.
Let's get a quick show of hands if I could. How many people actually own or use one of these devices on a regular basis? Anyone? A small number, that's a rarity. You guys, of course, of course. Do any of you have any details or information about aggregate data about who's using these smart devices, these health monitoring devices? Do we know if, for example, people in Europe are using it more frequently than Americans, or if Californians are using them or more likely to adopt this type of technology?
Well, today what we're seeing is that you have the European countries are now beginning to adopt. So we actually are starting to see nations like Denmark and Norway who are now requiring the use of standards to be able to implement. And you have a country like Denmark who's actually, as they rebuild their healthcare system, are eliminating 20% of the hospital beds because they said, we are going to deliver healthcare outside of the hospital. So they are changing the way that they're delivering healthcare intentionally through the rebuild of their entire infrastructure.
And I would say with our product, it's really anybody who has an iPhone or that would interface with a hearing aid. You don't have to be extremely tech savvy to be able to use it. It's very user friendly. So kind of seeing across the board all ages with hearing loss.
Like I said, it's a great time to be ill. The question that I've been dying to ask, insurance. I feel like the insurance world is going to go ape with all the stuff that we're talking about here. You were mentioning daily monitoring of patients. There's a best case scenario and a worst case scenario here. Best case scenario is your insurance company calls you up and says, I see you've been walking a mile a day, that's great, I'm dropping your premiums. And the worst case scenario is they call you up and they say, you've been eating key lime pie every day for the past week, your blood sugar's through the roof, you're obviously going to pay more. Is this a realistic scenario? Is that what we're going to see?
This is a huge fear of mine. There have been people that have approached me and asked questions that would lead me to believe that they're looking for the latter, and to which I have said, get out of my office and don't come back. But I think that in this environment of accountable care, with sort of like the Obamacare Act and all of that brings with it. I think what is going to start to happen is incentivized healthcare, where you do get perks for doing good things rather than being penalized for doing bad things. I think that we have enough people with consciences to stop the other thing from happening.
Maybe.
Yeah, maybe. But from my perspective, what I'm really trying to get to the bottom of is remembering that at the end of the day, just because you can monitor something doesn't mean you should. And trying to understand what is necessary to improve quality of life and what is just sort of invasive and not necessary, and which metrics are necessary and invasive, and how do we get patients to agree to have these things monitored. And that's actually been a huge challenge, because some of the reasons that patients don't want things monitored are completely hysterical, and others are, just human vanity, of course. Like there's the 120-year-old patient who's 90 pounds who will still not step on a scale if people are watching. So there's a lot of interesting things here, but yeah.
Well, actually, you make a comment about the accountable care. I think that's actually going to shift it, because it's moving it away from the insurance industry directly. Accountable care organizations themselves are actually dealing with your physicians, so it puts the responsibility at that level. So it's a little bit different in the sense that it's not the insurance company that's going to raise my rates. It's actually who I'm dealing with for my care. So as we go into more of the risk-based contracting, the more of that managed care sort of scope of how we actually do that, which is actually where the Europeans are today, we're going to see that shift to where it's not the insurance company, it's actually the healthcare provider that's going to put that pressure on you.
Maybe. I'm still pessimistic. I don't know. Cédric, do you guys work with insurance companies in any way? Is there any connection between your company and those companies?
So in certain cases, we have connection, and for which reason is if we can prove that owning such device or having such application can make a positive change, some insurance companies are interested to have their subscribers use these devices, and full stop, meaning that they do not need to have individual feedback. So it's a kind of partnership we have. I just have one comment on the way we see innovation I'm very convinced that each time there are some innovation, we can take it on the fear way and saying, okay, this is a new stuff, and collectively we'll say, okay, and let's stop thinking that it will steal our willingness and our free will and all our thinking process and sometimes there is this way of seeing innovation like we will lose control. This is what is happening, and sometimes it assumes that we all become very stupid, And I think that if we all agree in this room, that is a nightmare scenario. And like you say, David, there are a lot of people with enough conscience that it's not something that has to happen. And I'm often asked the question. It is a very legitimate question. Do you steal the data and do you sell it to insurance company? And the answer is very simple. No. Why not? Because first, it's illegal. I mean, I'm in a French company, and it's just illegal, and that should be an enough reason. And second, if it's necessary, is by doing that, what is the next thing that happens? I can close the company, because nobody will want to have any of this kind of device. And you can see it, as being conscious or just being, like I think everybody in this room, that we do not have to glide into the nightmare scenario each time there is an innovation.
The mind just instantly goes there. New technology, something scary is going to come about from it. But in this case, what we have is new technology that's enabling us to learn a lot more about ourselves and to be, in theory, to be healthier. So that's a great thing. Chuck, you mentioned the potential for doctors to communicate with the insurance companies, but that got me thinking also. The other thing I want to talk about here is the doctor-patient connection. So we have the potential for a transformation of the doctor-patient connection here. The other thing that people have talked a lot about in the technology world is telemedicine and telepresence, robotics, and things like that. To what extent do you guys think the emerging world of wearable tech is transforming or changing that? Does it obviate it, or does it make it more useful?
Oh, it definitely makes it more usable in that case. I think what you do is you're starting to provide a way and a common platforms for how you actually want to interact with this technology. We often move in from a consumer electronics space into that healthcare space. And in the U.S., it's sort of a fine line because when you move into the healthcare space, you become regulated. That you start to raise the interest of the FDA and become a regulated medical device in that case. And so it's a lot of times we still struggle with what is sort of that consumer-based technology that we can play with, we can sort of experiment with on our own, versus what actually becomes relevant for me to start handing over to my doctor. I want to make sure that he sees this, or he or she sees this, or somebody within the physician office in that case may actually want to see that based upon my care, because it actually becomes relevant to what's going on with my condition at that point. If I see a sudden weight gain and I'm recovering from a heart attack, that's actually fairly important statistical information, although that weight scale is relatively a straightforward instrument. If I'm gaining weight, that means I have a problem. I'm going to probably land back in the emergency room relatively quickly. But it's something, if I can have that available and I can share that with my physician, that actually becomes very key and critical in helping the health and recovery of that individual.
And I think we're going to see that more and more in the field of audiology as well, with people in remote areas not being able to have easy access to their audiologist. They can dial in and have their hearing aid adjusted, and especially in organizations like the Veterans Administration, they'll be incorporating that actually fairly soon, because they just the VA is the largest consumer of hearing aids in the U.S. and they have a hard time following up with all of the patients. So it'll be a huge benefit in that particular situation.
And just, I think what is new is not the idea of remote care or, remote monitoring. I think that has been around for decades. What is really new is that it's not anymore about pushing a piece of hospital at home, from your doctors, but accepting some technologies that you find, cool, sexy, that provide you with values, and that will, make this new bridge or new link with your doctors. So I think there are very, very good effects and sides on the consumerization of health, because it empowers the patient very differently, and it makes some monitoring acceptable in a very different way. And it's not about some people benefit hugely from having a piece of hospital at home, no question about it. But a lot of people in our population in the US, in Europe, will benefit hugely by having some kind of monitoring while they are not sick, and they are not very sick, and it's most people in this room as well.
So what we're seeing, a sort of interesting aspect of the aspect that we're starting to see people share their data in social media. So we have sites like Patients Like Me. So I may still have interaction with my doctor, but I'm actually taking my data now and sharing it with somebody else because I may have a rare disease that I want to understand what other people are doing with that disease state. Mm-hmm. We're seeing social media become a part of gaming as well. It's also one of the ways that we keep people active and engaged in the systems. You know, things like The Biggest Loser or Ginny Craig, where they actually have social competitions, and so they're sharing that data not with their physician office, but with other individuals in that case. So it's sort of getting over that hump that this data needs to be private in some cases.
Yeah, to build off actually both of those points, I mean, what I'm trying to develop, like my long-term view is that to sort of link into this idea of redefining rehab, I want a patient to be going, look at this thing, look at my thing that's on my arm, this is what it's doing, and this is how it's making me better, and actually being proud of it. We're not there yet, but we're rapidly approaching the point where people can be actually showing off their tech and getting away from this taboo of being unwell means that I'm weak or I've done something terrible or whatever. It's just like, nope, I have this health condition and this really cool device that I want to show off to everyone is helping me manage it myself. I feel empowered, I feel excited, and then building communities based on that. So actually saying, well, it's great to play a therapy game for my wrist and forearm, but I want to beat that guy, user number 220, I want to beat him because he's always beating my high score. And creating that competitive and supportive environment of a lot of people, that is how we push wellness forward. So really exciting.
And we're hoping to see the same thing with hearing aids as well. There's always been such a stigma and associated with it when there shouldn't be. And we've just been so excited about all the media that ReSound Links has gotten. And CNN.com came out with an online article, Can Apple Make Hearing Aids Cool? And that was just fabulous because it helps to promote that same type of thing you're talking about.
Yeah, it's remarkable the change in social media and social acceptance. I read this fascinating study a little while back talking about what sort of information people were willing to share on Facebook. And they're pointing out that after emergencies, when there was a tornado or something like that, people would post information that they would be terrified to post otherwise. Here is my address. I am at home. I need some assistance. Otherwise, there would be horrible privacy concerns. But here, in certain situations, that information becomes okay. And it's great if the devices that we have today can transform that as well, take away the stigma from hearing aids. I've lost a little bit of weight, or I've put on a little bit of weight, and perhaps you could help me, calling on the social network for that. That is a fantastic advancement. I could keep going here, but if anybody has any questions, I would love to field anything. We have a lot of experts up here, so jump right in, please.
So HIPAA, I'm sure has some great interest in this, the privacy of health care information. What are you seeing in that side?
You cannot swing a cat in the San Francisco Bay Area without hitting someone who is starting up a HIPAA-compliant data streaming company. That's what I have to say about that. There is a lot of interest.
One of the interesting things about the HIPAA law, though, is if you think about it, it's about how the interaction of data is between providers and insurers and provider-to-provider communication. What we're talking about is actually information that we control and we're handing off. And when we actually do that, it obviates HIPAA in a lot of cases. So when we are steering that data, when we have control of the data and are steering it, HIPAA actually goes away and almost becomes all irrelevant in that case. So it's only when I transmit my data to the physician office and they decide to do something else with it that it becomes a major issue in that case. So in this case, the HIPAA compliant data is really from a business associate agreement, how you actually transmit it from a data center to a data center. When I'm controlling that data, you basically eliminate a lot of that risk.
You're a lucky man, because clinical research, not so lucky.
In the back there? You've got a microphone there if you want it, sir.
With the insecurity of everything we do, communicating, on the internet, Wi-Fi, etc., it's all porous. Is there any possibility that one can get the data onto something secure, like a 1 terabyte memory, that we can control and show our doctors if we want to, rather than having to go through Apple, which is porous, or the internet, which is porous, or Wi-Fi, which is porous?
From our perspective, yes. We have the architecture that Continua represents and has set out today for the devices gets broken into several sectors. So you have devices, you have the hubs that collect the data, and at that hub level, it can be a smartphone running an application, it could be a purpose-built box in this case, it could be something in the cloud that you may want to have as your own personal service that you're running on the back end. So quite effectively, we actually have that capability exists today from a couple of companies where you can actually collect that data directly from a device and put it into a memory stick and then carry that information into your physician office. So that's relatively straightforward.
Just to continue, as a cancer patient, I wear around my neck a memory stick with all of my measurements, my urologist, my oncologist, my dentist, my primary, and I share the information with them. I keep track of it. And I ask them in most cases, look, this is for you, don't put it in the system.
And that's quite feasible today. I mean, it's something that's actually usable, and as long as you have it as a readable, human-readable format, they can basically plug that USB stick in and open it up and be able to see that. And there are very well-defined standards for how that is actually implemented today, under IHE and how you actually show and display data with the clinical care document. So it actually is basically a record that you can open up in any in readable format in most cases.
Totally agree. I mean, I think there's a lot of value in developing, and I've been working on this a lot, developing user interfaces where someone like yourself could walk in with a tablet and say, these are my metrics. And they see a graph, and at a glance, any trained professional will be able to know, okay, this is where you're at, and then you shut the tablet. They don't need to keep it. They can, then they can continue on with their examination. If that's your concern, I think there's totally systems that are being built to help you with that.
It's interesting because most physicians aren't interested in every data point that you have. They're actually only interested in the trends. So, and by aggregating that data yourself and just showing it to them, that's all they want to see is the trend. Are you going up? Are you going down? Are you getting at a critical point, whether that's within your norm?
We have a question over in the corner.
Ignoring all regulations, like products like Fitbit, which are becoming popular, if they were to give you raw data, what do you think we could do with this? Just an accelerometer-based information. Like, what could you differently, besides standardizing, like how many steps you actually are taking and validating that that's an accurate thing? Are there other metrics you think we could pull from raw data that we don't see in the landscape right now?
Well, the answer is yes. I mean, really, for me, the value of raw data is, first of all, knowing where the metric comes from. So in a lot of systems that I've been working with that give me a sort of a glossy, sort of rose-tinted view of the data, when you actually look at the raw data, they're running median filters through it, they're running all sorts of different things through it, and when you actually look at the raw data that was collected, it is absolutely not representative of what comes out on the front end. And that is the biggest concern for me, is not so much what I could do with it all, is actually cross-checking and cross-validating what's coming out of the device. Because that's because if you're using it to engage in your own wellness and because I'm very sensitive to the idea of this is great for the consumer. This is a great device if it works for you and it motivates you to get up and moving and doesn't stress you out too much, go for it. But if you're going to use it for clinical and medical research, it's not okay to use their metrics and have no understanding of the black box, because they also don't share the analytics pipeline. So they don't even give you too many details about what's being done to the data. So
well, do you think a company like Google or Facebook or Apple could come along and smooth all of that out and make it easier for you?
I hope so. I'm big into collaboration, and if Apple says to Fitbit, release your raw data to our users, that would be huge.
Yeah,
are they going to?
Obviously, standards do that as well. So, I mean, that's what you do in getting that data. But to your point about the data itself, it's actually useful. At the individual level, that data becomes useful for in context of who the individual may be in this case. If I'm a relatively fit athlete and I'm using that data, that means one thing on what that performance raw data means. But if I have this stuck on an individual who's a 90-year-old at home by herself, that actually means another thing. Is she getting up in time? What time is she getting up and during the night? And where's that pathway actually taking her? We can see trends in that case. We can actually see cognitive trends from just simple exercise data. interestingly enough. We can actually see, are they moving around at the right times of the day? Are they moving around in the right amount of fashion? And in some cases, depending upon how the sensor and where it's attached, we can actually begin to see gait differences in how they actually are walking around in that case as well. So you can do different things with the raw data, depending upon as long as you know the context of the individual and what you actually maybe want to be trying to derive from that.
Yeah, I'm actually doing a clinical trial right now with straight up wrist-mounted accelerometer on a couple of stroke patients, and we're trying to see if we can identify stroke patients with pathological apathy following stroke, which it really changes the way that you engage with that patient and treat that patient. And we finally found a wearable that would allow us to extract the raw data, and one of the initial findings that we found that was really valuable was nothing to do with a little bit to do with our study, but essentially you could, on this wrist accelerometer, you could see during the night, in certain patients, it flatlines. There's absolutely nothing going on because they're sleeping. Other patients, you can see all of this periodic activity where they're thrashing about. Turns out, surprise, surprise, on those days, that patient appeared apathetic, but wasn't apathetic, they just hadn't slept very well. And the ability to, with a very cheap wearable, to, when the doctor walks in, to be able to just look at that trace and go, oh, holy crap, this person didn't sleep very well. Let's take it easy on them on physical therapy today, and let's give them a few extra sleeping meds or whatever tonight to make sure that they remain still and get some good rest. That's immediately valuable information to us that wouldn't have been available with a device that has a sort of locked off back end.
That's fascinating. Quick question for you, Cédric. Do you guys have any information about adoption? Do people keep wearing their smartwatches, their smartbands, or do they wear them for 3 months and then give up? Do you have any data about that type of information?
So we do have a lot of data, and one of the very reasons we look at other way to see this tracker and smartwatch is that the fact that after a few weeks or on average after 6 months, trackers tend to stop being used. And so for us, that's an issue, and designing a device that people will be eager to wear and for long term, serve a purpose, serve a features, which is impacting the level of your activity for the long term. So it's very different compared to if you look at these wearable trackers compared to a device such as scale. And we have this connected scale that once they're set up, and they have 1 year of battery life, so you just use them as regular scale, and the adoption and the stickiness is very, very different and much above the 6 months metrics. But I think that's a very important question to ask, because otherwise we keep being in gadgets or the things that everybody is able to do for a short enough period of time, which is quite anything. You can do put your iPhone under your pillow and access a couple of nights. You more likely will not do it for a long term, and that stands for a lot of things that are intrusive. It can raise awareness. I mean, you can get some insights, but at the end of the day, it doesn't change anything from being on the 1st of January and saying, okay, I will do this and that, and dropping it after a few weeks. What we're looking at is really finding the dynamics to change that.
We have just a few minutes left. Question up front here.
Or Wi-Fi, whatever, I heard it could have impact on the brain or something. Is that, if you all have all this wearable all over the place, is that have a bad impact for the health? Thank you.
Jill, you've got a device right next to the head. Is that something that we should be worried about?
With hearing aids and the Bluetooth that we're using, it's Bluetooth Low Energy, but even before that, it's a fraction of what people use every day with their cell phones. So there's absolutely no danger at all with the Bluetooth or the connectivity with our hearing aids.
Yeah, you're more likely to get more radiation from your microwave than you are from the Bluetooth, and they're in the same frequency range.
But I think as a company, it's a legitimate question and concern. So we have to tackle the concern. I was trying some sleeping sensors that requires to put a helmet, and I had headaches. So I don't know if it was because it was too tight, because it was Bluetooth or because I was thinking that I had Bluetooth. And I'm thinking, a lot of people would think like that. So the way we look at sleep sensors is that first it has to be non-intrusive. So we design a pad that goes under the bed and that is wired to a bedside device and that provide no EM electromagnetic activity during the night. And in fact, again, as a company, whether I mean, nothing proves that there is danger about it. I mean, I don't want to be misunderstood about it, but that's in fact not the point. If you are trying to convince people that this or that solution will be relevant in their daily life, and you just have to answer to the concern, and it doesn't really help to say, okay, science hasn't proved that this level of microwaves that are much below what you are when you are 3 meters from your microwave oven. That doesn't count if you don't feel like this. I have to find with another solution, and we are very modest in when we emit microwaves because we just need to answer to these questions.
I read the article. They said that if you in a room you're sleeping, if it's very close to the wireless router, it will make you headache or something.
I think it's the same answer. If you look at the science, I mean, to my knowledge, there is no proof or any, side effects and negative effects. But we can go, very long on this, over square rules, etc. But I think that's not the subject. It's the concern and how you feel about it.
Yeah, there's no easy answer to that question. There's definitely a lot of studies.
Just sorry for I don't want to bring that on, but we do some baby monitoring devices, and that has wireless Wi-Fi, and we just put an Ethernet plug because we think that some parents don't want to hear about these over square rules, and if it's 3 meters, it's square. Is less than powerful. If you think that's not good for your baby, and we think we just had to add some Ethernet wire, then respect this concern.
We got to cut it off here, folks. Thank you very much. A big thanks to our panelists who will all be around afterwards. If you want to ask them a few questions. Been a pleasure. Thank you.